Okay, so I am at the website for St. Joseph Hospital. And um, initial impression, it's uh, it's not bad. I would expect the images to be scrolling, so always having children on the initial page seems a little odd to me unless it's a children's hospital. But it doesn't look like it is. It looks like it has other services, so I would expect to see a different image. I'm going to see what's working here. Find a physician, health library, classes and events, patient guide, visitor's guide. Um, visitors should be S apostrophe. Insurance and billing. Okay, find your loved ones with ease. Find your loved ones with ease with our visitor's guide. Okay, so it's a placeholder page. But that's good. I've seen that at other hospitals, so I guess I'll go back to the front page. For medical professionals, referring physicians, clinical career opportunities, code of conduct, medical publications, and continuing medical education. Well, that's quickly and easily refer your patients. That's that's good. Let's see what clinical career. Okay, so that's not optional yet, but that's interesting. Services. Okay, so here's the different departments, and that's good. Telehealth services. Interesting option. Orthopedic services. Overall, seems to be okay. Neurosciences looks like, unless that's one I haven't heard of, neurosciences, but I think it's misspelled. I think it's supposed to be Neuro. Occupational health services. Okay. Maps and locations, that's good. Register for a class. So you can find a location up here and find a location here. That's good. And look at my chart. Okay. Assuming there's a sign-in page on that one. Interesting that I would expect services and locations to also have information below them. And I don't see the connection between St. Joseph Hospital and Exempla Healthcare. So I'm not real sure what that means. Wards, that's interesting. Okay. All right. So overall, a pretty good impression. I like the image on this page. Overall, that looks good. Family medicine services, that's good. Um, Odd wording. We're looking to hire caring individuals. That seems like kind of a southern way of talking, and I think I think it should be rewritten. Sleep disorders, okay. I like the sleep center services, that's interesting. Locations, careers, and about us. Okay, so nothing on those as far as even a placeholder. overall, it looks interesting to me. Find the hospital's address. I saw that. Um, well, I don't know if I saw it or not. If this example of healthcare, if that's the hospital's address or not, let me go back to, oh, I guess it does say example here, so um, I guess this is it down here, the example of healthcare in Denver. Find the services. That is easy to find. And I'm assuming if there was more than one location, that would also be easy to see. But services are right there at the menu across the top. Find the orthopedic and total joint services. Okay, so here is orthopedic services. And talks about total joint replacement under orthopedic. So that looks pretty easy to find. Find a physician tool, that was under patients and visitors, and find a physician, and I also noticed that it was available on most of the pages, at least initially it's over on the right hand side, so that's good. Click submit. Oh, once found and reviewed, click submit to see physician results. Oh, okay. Alright, so it looks like you just need a last name to find specialty. I'm guessing this doesn't work, but looks like it'd be easy to find a variety of physicians this way. Request an appointment. Okay, so I'm going to go back to patients and visitors, I think. Oh, and you can find a physician right on the front page. Make an appointment. Well, that wasn't as easy to find. Oh, and there's the address again right up at the top, and I missed that earlier. So, find a physician. Kind of odd. It looks like making an appointment isn't where I would expect it to be, because I would expect that option to be right under for patients and visitors. Services. I want to make an appointment. Easy to register for a class, but not as easy to make an appointment. That, I mean, it looks like you might already have a physician, and then it's not as easy to make an appointment. So I think you need another category to make an appointment, because that's just not. Request an appointment with a physician. So if I find the physician's not working, so I guess I'd have to contact somebody, and that's not an option. Patient guide, register for a class. I'm not seeing any way to request a physician. Go to About Us, that's not working. I guess I'd go to Contact, but that's not working. Find a location. Okay, maybe my chart. Seems kind of silly to have to go to my chart to make an appointment. And it still doesn't come up. Well, I would expect I would expect it to be more obvious how to make an appointment, and I'm not seeing it coming up under anything. It just isn't there. Insurance and billing, classes and events. Like I said, I can register for a class real quick, but I'm not having much luck scheduling an appointment. So that I think needs to be changed. It's got to be easier to make an appointment. Okay, yeah, I saw where I could donate right up here at the top. Why can't I make an appointment right up here? Unless it's under my chart or going to be under my chart, but I want to be able to make an appointment as easily as I can donate. So that's real easy to find. Information on classes, again, register for a class is right there. Patients and visitors, go back. Patients and visitors, classes and events, that's real easy. Much easier than making an appointment. So there's the class page. Available careers, I saw under two places. There's a menu option for careers. There's also something for medical professionals, and it has clinical career opportunities under that. So that's easy to find. Find the most recent news for the organization. I'm assuming it's probably under About Us. And there's a news option right there, so that's easy enough to find. So everything except making an appointment.